Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you, and today we will discuss the mayor of disease occurrence, or we call it prevalence, incidence, and some other morbidity, mortality rates, ratios. So all these are discussed today in this video. If you are new, please like it, share it, and if you are MBBS students or even the postgraduate students, Dr. Hussain Bashkolachi YouTube channel is discussing community medicine subject as well as the public health. So let us share the screen and let us come to that point. Uh, so this is uh, quantifying the burden of disease or mayors of disease occurrence, you can say. In other words, it is basically an epidemiological field, and it provides mathematical foundation for public health intervention and community medicines. And we can divide it into occurrence, etiology, prevention, so on and so forth. So let us go further. Two words are very commonly asked in most of the examinations, and you can see that the incidence is the new cases are the measure of the risk, and prevalence is the measure of burden. So if you will tell this, then number of new cases and number of existing cases, new and old, in a population at a specific point in time and defined by time period. So these are the definitions, and primary focus is rate of disease or spread and the probability of the healthy individuals to become ill, while the primary focus of the prevalence is reflects the cumulative impact of the disease on the healthcare system and society. Cumulative means overall. Clinical utility used to evaluate the effectiveness of the prevention program and track emerging outbreaks. And here, clinical utility is essential for resource planning, hospital bed allocation, and long term care budgeting. Incidence rate of flow into prevalence is equal to total volume or total burden of the disease. Mortality rates and case fatality rates are two other measures of disease occurrence. And the mortality means lethality, and case fatality means how much is the risk of the death. Mortality metrics distinguish between the general population's risk of death and the lethality of a specific disease among those who are infected. Or you can see the lethality at individual level and at a population level. These are the two things. Comparative index, you can see that the crude mortality rate per thousand, if it is high, and case fatality rate is also moderate, then you can see that this can have a total population as well as the diagnosed cases. The case fatality will be calculated from the diagnosed cases, and crude mortality will be calculated from the population. It is basically a mortality matrix and snapshot of the situation. Then the epidemiological triangle, we have environment, we have susceptible host, and we have biological agents. Disease results from the complex interaction between a biological agent and susceptible host and an enabling environment. Understanding the three vertical Uh, Vertices means angles is critical and effective public health intervention. And in environment is considered external factors, while susceptible host is organism or the disease harboring person. And the biological agent can be infectious agent, virus, bacteria, parasite, whose present essential for disease occurrence. Then dynamics of the disease evolution. Evolution theory explains how pathogens adapt to host defense and environment pressure, shifting between virulence and transmissibility to the maximum fitness. So these are the four stages in which pathogen enters: host exploitation or multiplication and transmission of and optimization and a stable long-term equilibrium, reaching a stable virulence transmission ratio, and we call it uh, R naught ratio also. Different strides, distinct strategy. Cholera containment focuses on environment intervention, while COVID focuses on host and inter-agent interaction. So you can see that sometimes you have to do more on the environment side. And John Snow in London actually surveyed the Thames River and ultimately the Broad Street and reached to the sources as well as the um, water pump. And ultimately, the handle of the water pump was broken so that people could not collect water from that source, and ultimately, the cholera was contained. Containment efficacy is dictated by identifying the most vulnerable node in the triangle. Mirroring the evidence, mastering these calculations and frameworks is essential for practicing or predicting outbreaks and allocation of resources effectively. And you well must understand the health landscape also. So I think with this we are concluding, and we have discussed incidents, which is basically a new cases, risk factor, and prevalence. Old and new cases are the burden of diseases for allocation of resources. Here, where the disease is going and outbreaks can be predicted if the incidence is high. And we have also discussed the epidemiological triangle. So I think if this is the situation, I think the understanding of measures of disease occurrence, even the crude death rate, and even the sensitive indicators are infant mortality and maternal mortality, uh, even the child mortality, because these are very sensitive indicators. So with this, I think I am ending. I hope we will continue with this, but if you have any question, query, or any comments or addition, please do write in the comments and press the button so that you can get the more videos on these topics. With this, I think we are ending, and Dr. Hossein Bushkolachi is thankful that you are watching and liking my videos. Thank you very much, and let us